Good evening, good afternoon, and good morning. This is the 2094th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. PRATIK NAKUM. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with anyone who loves homeopathy. The purpose of the forum is to take homeopathy to every home around the world. We have already uploaded more than 3,650 videos at YouTube. Those who missed the session can watch it from YouTube by searching IFPH Homeopathy. So let me come to today's guest. Today our guest is Dr. Pratik Karnikam, has completed BHMS, PGDEMS, PGDCC, CFN, CSD, CYC, and CSCH, and he is a medical officer at Sainath Homeopathy Hospital in Pediatric Department attached to Rajkot Homeopathic Medical College, Paul University, Gujarat, and is a consultant homeopath at Dwarkish Clinic and Skin Care. He is a consultant cosmetologist, trichologist, and anesthetician, yoga expert, and nutritionist, emergency medical services specialist, and he has written more than 25 articles and publications in national and international journals. That's something great at this younger age. And today, Doctor will be coming with a beautiful subject that is beyond the skin, integrative homeopathic insight into eczema and ringworm. As we know that these are the areas where if a homeopathy concentrate, you can win the heart of many patients, and thereby homeopathy will be the winner in the uh, end. So let us proudly welcome Dr. Pratik K. Nakum to this session. Welcome, Doctor.
Hello and welcome everyone. Am I audible to you? Am I
Yes.
visible and audible to everyone?
Yes, audible and visible.
Yes. First of all, yes. You already introduced myself, and I just want to, first of all, want to thank you that in this platform, I just want to share my knowledge, and thanks for letting me that kind of giving chance. And that's a wonderful platform, so I can share my knowledge about skin and all that kind of stuff regarding homeopathic medicines. So thank you so much for this kind of platform you are giving me, and let's proceeding ahead if you are permit.
Yes, you can share.
Yes, okay.
It is better to
Just a
kindly
second.
adjust the curtain a little more.
Screen is visible? PPT
Yes,
is visible, sir?
yes,
Yes.
visible.
Okay.
You
Just
can
let me
make it
start.
big. You can
Today's topic is beyond the skin.
you can make it
Integrative
bigger.
homeopathic insight, and I just want to share my knowledge on skin and regarding how homeopathy wonders and how homeopathy come to the rescue in such kind of diseases where allopathy and all that pathy fails, and that kind of homeopathy has a miracle and belief system that we all know about, right? This much is all about my introduction you already given.
Doctor,
I just working as a medical officer at Sainath Homeopathic Medical College, and now I am owner of Dwarkesh Clinic and Skincare, having multiple degrees as you can see. But the first and foremost thing is that if you treating patient as a whole, then and then you are a perfect doctor as per the Hahnemannian, sir. Right? You are treating not
uh,
just only sign and symptoms, because we
doctor,
are treating patient.
can you make it a big screen, full screen?
Yes.
Just you click on the side. Yes, it's fine now.
Fine.
Yes, fine.
Okay.
Keynote speak.
Now, today's topic is skin and beyond the skin, right? I choose this topic not just I just decided and put it on the screen or put it on the PPT. this is the thing that beyond the skin, right? So beyond means there is kind of things under the skin. So we need to look into, because we are treating not only just signs and symptoms, as I earlier told you. Because if patient comes to your clinic and he or she explaining about skin diseases, and we just only seeing their skin and giving the medicine according to them, then patient might not be getting well, because we are just seeing the skin, right? But homeopathy tells us that if you are treating the patient, then treat it as a whole, not just the sign and symptoms, right? So if we give medicine on the sign and symptoms which patients are narrating, then we might fail. But Dr. Hahnemann says homeopathy never fails, homeopathy does. So in this scenario, we have to look patient as a whole. That's why I choose this topic, beyond the skin, and integrative insight of homeopathy into the ringworm and eczema. Right? A philosophy is simple: is that the soil versus the seed, that treating the internal terrain to eradicate the external disease. So we just treating the patient as a whole and nothing else. First of all, I just made this lecture in the three parts. The first part is the biological shield, in which the biological shield includes anatomy of the skin, physiology of the skin, and the five critical stages of pathophysiology, where we can learn how skin is that, or how anatomy, physiology, and all that critical phases that leads to the skin disease, or which kind of covering, that protective covering skin has. In second part, we'll need to look about the clinical portraits, that is deep dive casual analysis of ringworm eczema. There is many chronic diseases, skin diseases, but I just put it ringworm and eczema because there are vast patients out there in the world, especially as I am talking about Gujarat. Then in my locality, ringworm and eczema is more prominent. More patients are come to the clinic just because patients having a ringworm and eczema. But as I told earlier, that I just don't treat the patient according to the sign and symptoms. Then and then, if we treat patient as a whole, then and then we can get the perfect and wonderful result that I will eventually show in the later on. Just talk about the third part, constitutional part. Skin is visible or not?
It is visible. Lecture on my
Visible.
yes, yes, visible. Now you can go ahead.
Okay,
The
okay.
clinical
So as I am
background.
explaining, this lecture is made on the three different parts. There is first one is biological shield, in which anatomy, physiology, and pathophysiology is concerned.
Already mentioned, doctor. Yeah.
Yes, yes. And the second part is clinical portraits, and third one is constitutional, that is miasmatic and expert take regarding case taking and all. Now, let me start about the anatomy of the skin. The anatomy of the skin is very simple, but it's a vast topic. So I just cover main points. The integumentary matrix, the skin is the largest organ of the body, acting as a dynamic macroimmunological barrier organized into three zones. Our skin is not just outwardly reflecting organ, in which there is a many things inside the resides. So we just looked into all that kind of stuff also. We just not rely on the outside sign and symptom, as I told earlier, or outside reflected things which might be eczema, ringworm, scabies, or all that diseases we can see in day-to-day life. There is a three layer in the skin. First of all, epidermis, that is outermost protective layer, and the second one is dermis, that is core housing collagen, nerves, and vessel, and third one is deep fatty tissue for insulation. So here you can we all see that the epidermis layer, that is outermost layer, but inside that is nerve, fatty tissues, and all things are reside wonderfully. That is deep fatty tissues, stratum, all that kind of layer, stratum corneum, stratum lucidum. The second layer is dermis, core which contain collagens, nerves, and all that. And third one is subcutaneous tissue, hypodermis, that includes the deep fatty tissues as well, right? So anatomy of the skin is very simple, as I told you earlier, but the outermost layer containing having many possibilities to catch infections outside by viruses, by fungi, by any allergies. So outermost protective layer is much more important than inside layer, because outermost layer is having we can say that entry of bacteria, viruses, and all that kind of bacteria, or which can affect the skin very dangerously. And second one is dermis, and third one is hypodermis. So then mm, we can go ahead like the epidermis layer, as I told you about, that is a outermost layer. The outermost multistratified cellular layer, it is devoid of vasculature and completely reliant on deep diffusion for nutrients, right? What here they are saying is that multistratified cellular, that is that also concludes also having multiple layers, like stratum corneum, stratum lucidum. So that layer are also having some responsibilities to not let bacteria, viruses, and fungi inside the body, so that we can't get any major diseases. And what here they are also saying that vasculature and completely reliant on deep diffusion for nutrients. So he also relies on the deep diffusion under the skin. Here keratinocytes, melanocytes, and immune cells are saying outermost layers contains keratinocytes, melanocytes, and immune cells. So by which we can our skin protects many that fungi, viruses, bacteria, and all the allergies. So first one is keratinocytes, the bricks of the cells providing structural integrity. Just imagine if we don't have keratinocyte, then imagine what kind of skin diseases in bunch we can have, because keratinocyte is a bricks of the cell, like that's the kind of structure that put it as a shield outside the skin, and that can protect the skin entirely, because skin is the largest organ of the body, and our inside toxins can't remove properly, then it will outwardly reflected on the skin as well. Then and then we can see the ringworm, eczema, scabies, psoriasis kind of stuff. But we can't get, because we have this kind of wonderful things that God created, that is keratinocytes, melanocytes, and immune cells. So first one is we call it as a bricks of the cell. So that is very important, providing structural integrity, so that we majorly not getting any outside allergies to get any skin disease, right? Second one is melanocytes, that is protective pigment cells shielding against the UV radiation. We all know about the melanocytes. I just giving in a short thing that protective pigment cells shielding against the UV radiation. Outside it, if we go outside the area, and what to say, ultraviolet radiation are always there in the summer in more intensity or more narrow band. But we have melanocytes. So you can also see that if we go outside for 10 minutes or 50 minutes in the summer, and then if we go continue in 15 days or 20 days, then our skin will become what to say, slowly blackish, because of the melanocyte. So it is a protective pigment. It is not directly affect our skin and burn it down entirely, because we have melanocytes. So that is another wonderful things. First one is the keratinocytes, second one is the melanocytes, and third one is the immune cells, that is Langerhans cells patrolling for pathogens. We all know Langerhans cells is more important, and it will invade the pathogens and completely avoids and outside the human body if we have proper immunity. So Langerhans cells are also patrolling for the pathogens. If we have any kind of pathogens in the skin, likewise, if we get any wound and it will not completely heal, and then outside it, bacteria, fungi, viruses that can also invade under the skin, and some kind of toxins resides our skin. But we have some kind of cells, as we told earlier, that is keratinocytes, second one is melanocytes, and third, that is immune cells. So Langerhans cells are patrolling for the pathogen. That is the word patrolling. That is a finding that if any toxins reside in the body, then he can directly find out and destroy it directly. And we all know that three kind of things, keratinocyte, melanocyte, and immune cells, are much more important than other layer, because these are the stage, or these are the place where pathogens invades, right? So the first one is the epithelium layer that I told recently right now. And the second one is, you can see on the skin, the dermis layer. What here they are saying is that vibrant core, that is dermis, is rich in collagen and elastin, contains hair follicles, sebaceous glands, pseudoferous glands, etc. Look, first we see epithelial cells containing three layers. That is epithelial layer and epidermis. Second one is dermis. But in dermis, there is also things included like hair, its follicles, sebaceous glands, pseudoferous glands, etc. Now, what we are talking about the dermis layer, because it has some kind of responsibility to protect our skin from the outside pathogens. Mechanical protection is that hypodermis and subcutaneous adipose tissue bed providing fat storage and the mechanical salt redirection. There is a hypodermis layer, that is subcutaneous. Subcutaneous adipose tissue providing fat storage and mechanical salt redirection. So inside the skin, there is a, wait a minute. Right. There is a third, immune cells, and right now we are talking about dermis layer. So there is a vascular loop for the nutrition. Uh, as we told earlier, that skin is outer layer is totally dependent on the internal layers for the nutrition. Second one is nerve ending for the sensation, and third one is a connective matrix for flexibility. Right. So it is called as a vibrant core because it has also contains hair follicles, sebaceous gland, and pseudoferous glands. Right. Now we are moving ahead with the physiology of the skin. The skin is completely give under the intrometric system. Here you can say in the images that is stratum corneum, stratum lucidum, stratum granulosum, right? As I told that hair shaft, you can see there is a sweat spore, outermost layer epidermis, and it also contains layer stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, and stratum basalis. And then you can see the second layer, that is dermis. Inside the skin, there is a hair follicle, hair roots, there is a sensory nerve endings, there is a sebaceous gland. There is also one muscle you can see over here, that erector pili muscle, which is very important for the skin. There is a sweat glands. So sweat glands, what to do? That insider toxins released from the skin, so that we can't get skin diseases very early, because our immune system is very strong. If we have that all three, the Langerhans, that cells finding the proper pathogens, right? And then we can see over here that artery, veins, capillaries, and adipose tissue as well. So what is the physiology of the skin? It is also very important to know about the physiology of the skin, because without knowing anatomy and physiology, we can't go, or we can't proceed ahead in the treatment part of view. Because if we don't know the proper physiology, or where it affects, in which layer this disease can go, or disease can spread up to, then we can't judge the disease predisposition and the prognosis as well. So that it is also important to know about the physiology of the skin. Thermoregulation, there is a dermal arterial networks dynamically dilate or contract in unison with the sweat excision to regulate core stability. As I told earlier, that sweat glands what do that, all the toxins inside the body that will remove directly from the skin. If any toxins resides in our body, then and then we can get skin infection regarding we might get ringworm, any other psoriatic condition, any other flare-up conditions, if we not having proper immunity, if we not having proper hydration and nutrition as well. So thermoregulation is also very important. There is a sensation architecture. Specialized neuroreceptor translate touch, pain, and pressure into CNS signals. If people can touch us, then we understand, yeah, something is happening in our body, outside the body. And we directly, our mind signaling that if something happens outside the body, so by which this kind of procedures can happen, or this kind of things can happen, because our neuroreceptor translate is touch, pain, and pressure into CNS signals. That is central nervous system. That is wonderfully explained in detail, but I just put it here, over here, important things, so that we can know about some basic knowledge about the integrative system, right? So specialized neuroreceptor translate touch, pain, and pressure into CNS signals. So up to now, we learn about the outside layer, that is epidermis. Epidermis contains stratum corneum, stratum lucidum, stratum granulosum layer, stratum spinosum, and stratum basale, which these 5 levels. Then in dermis, inside hair follicle, hair root, sebaceous glands, sweat glands, erector pili muscles, sensory nerve, artery, vein, capillary, and the third one is the hypodermis, that is subcutaneous tissue, which contains adipose tissue, which is very responsible and very important part of our body, as we all know that skin is the largest organ of the body, right? Now we are proceeding ahead with the biosynthesis matrix, D3 vitamin synthesis, UV protection barrier, and third one is immune surveillance. Keratinocyte utilize UVB radiation to catalyze the synthesis of essential systemic vitamin D3, managing calcium delivery and systemic cell health. So what here they are saying, that biosynthesis matrix, right? Vitamin D3 synthesis is also very important in our body. UV protection barrier, because we all know about melanocyte, as we told earlier, that it also the skin barrier which protects UV, that is UV radiation, UVA, UVB, and third one is the immune surveillance. So keratinocyte utilizes UVB radiation to catalyze the synthesis of essential systemic vitamin D3, managing calcium delivery and systemic cell health. Now the invisible shield, that is skin microbiome. What here they are saying about the skin microbiome? A diverse ecosystem of bacteria, fungi, and viruses that act as a native defense mechanism. This second skin prevents pathogen colonization and communicates with the underlying immune system. So that is the reason why skin microbiome called as a second skin, because it prevents the pathogen colonizing and communicate with the underlying immune system. That is very important, because if this skin microbiome or barrier is not there, then we can get directly infection from the outside. And you all know, if this kind of protective barrier are not outside the skin, then we can get easily lots of many more skin diseases right now. But fortunately, God give us wonderful this kind of structures, and with the help of all that, we are very safe under this kind of stuff, right? So a diverse ecosystem of bacteria, fungi, and viruses that act as a native defense mechanism. The second skin prevents pathogen colonization and communicates with the underlying immune system, right? It maintains the acidic pH, that is -5.5, produces antimicrobial peptides, which is also responsible to destroy the pathogens and outside and inward, that is bacteria, fungi, viruses, and other allergens, which might cause any other skin chronic diseases. And third one is the balances internal physiology. So skin microbiome is also very important for the balances skin physiology as well, right? Now we are moving ahead with pathophysiology of the disease. First of all, we know about the anatomy of the skin disease, 3 layers. We all know epidermis, dermis, and hypodermis. Then we know about the physiology, how it can work. Vitamin D3 synthesis, we have keratinocytes, melanocytes, and immune system, in which the Langerhans cells are patrolling for the pathogens. If any pathogens inside the skin, inside our body, then we can then it can directly push out through the sweat glands and destroy them immediately. Now, we also have to know about the pathophysiology of disease. Look, as anatomy and physiology is also very important, then pathophysiology of the disease is very important, because we can't judge a disease by looking outside, because we treat the patient as a whole. So we know about everything, and then we can directly come to the topic where medicine is selected, and all that kind of stuff are included, right? So pathophysiology of the disease is skin disease is never an isolated event. It arises from a complex interplay of, right? Here a wonderful line said about it. Skin disease never an isolated event. There is no any outside invades, bacteria, viruses, fungi alone can making that kind of skin diseases. There is a complex interplay. First one is the genetics, right? You people might wonder about how genetics are important in skin diseases, how it can relate to this. But there is a one filaggrin lack and barrier predisposition. So before moving ahead, we have to know about what is filaggrin, because genetics also affecting the skin disease, right? Genetics in which filaggrin, it is a protein which binds with the keratinocytes and the skin barriers which protect the outside layer from the bacteria, virus, fungi, and allergen, right? I'm repeating twice. Filaggrin is the protein which binds with the keratinocytes and binds with the skin barrier that act as a protective barrier from the viruses, bacteria, fungi, and other allergens or other pathogens to enter through the body. So it is very important. So what here they are saying, if we lack filaggrin, so what it directly means, we not have any protective layer, as filaggrin combines with the keratinocytes and skin which protects the skin. So deficiency of filaggrin protein which leads to the other skin diseases, right? So that's where genetics is very important. If that kind of protein is mutated and at DNA, then we don't know about why this skin diseases come from. So first of all, we have to know about this kind of protein, filaggrin. If filaggrin protein is lacked, then our outside protective layer is not very strong, and we can get directly exposed to the outside bacteria, allergens, fungi, and pathogens, right? So we move to the next one, that is stress, emotional triggers, and nervous dysregulation. Stress is very common in our world. In a day-to-day life, we all having many stress. But here, what kind of stress is included? Emotional triggers, because patient or if patient comes to your clinic and he is directly weeping, he is directly not in a mood to say about everything, that kind of emotional pressure from the life, it might be from the business perspective, it might be from the loved ones, it might be about some other work related issues. So that kind of emotional triggers also include also causes many skin disease, right? There is a psychosomatic condition. If we put too much stress on the brain, then we can directly see on outside of the body, which we might have gut problem, might have skin disease, might have many irritability syndromes. So stress is a silent killer, like, because diabetes is also included because of the stress. If we put too much stress on the brain, then it will also dysregulate our hormones and sugar level as well. So if stress is also important, emotional triggers and nervous dysregulation. And third one is immune, that is inflammation and chronic dysbiosis. Immune system, if our immune system is very lack, then we directly know about if something is putting outside, or we got any wound, then it not directly healing, right? Because our immune system is very low. So then we get any inflammation or chronic dysbiosis. After taking medicine, we can't healing properly at the time, because our immune system not responded as they have to respond it, right? So there are the pathophysiology of the skin, that is include the genetic, as I told about the filaggrin protein. It is very important. If filaggrin protein is mutated at the DNA, then it will directly protective layer is not much more strong, and we can get direct skin diseases by invading the bacteria, fungi, viruses, allergens, and other pathogens. Second one is stress, that is emotional triggers and nervous dysregulation. Third one is immune, inflammation, and chronic dysbiosis, right? Now we can proceed ahead with the barrier breach, eczema. What here they are saying is epidermal shield destabilization. There's a much important topic to know about. Fundamental filaggrin proteins degrade. As I above told you, that filaggrin protein degrade, then outside that protective layer is not much more strong, right? So here fundamental filaggrin proteins degrade. It means it will degrade and lipid envelopes wash out, leading to transepidermal water loss, that is TEWL. So because of the filaggrin protein degrades, the transepidermal loss is seen. Here are the molecule surfaces, and there is a compromised lipid barrier because filaggrin in the first image we totally see the gold makeup molecule, that is filaggrin protein. So it is a protective strong barrier. And in the second one image, the lipids envelopes wash out and leading to transepidermal water loss. What is the clinical manifestation of this? That is xerosis. Because in a dry skin, it is not much more moisturized, right? So the xerosis can occur, deep cracking, and unrestricted allergen entry. Because here filaggrin protein is not very much strong and it degrades, and eventually transepidermal water loss is seen. So because of this, xerosis, deep cracking, and unrestricted allergen entry is possible, right? Now we proceeding ahead with the immune overreactions. So what here they are saying is that pathogenic cytokine storm, if allergens, bacteria, viruses, fungi, or any kind of toxins move in the body through the skin, so there is a much more reactions happens in our body, that is pathogenic cytokine storm. Environmental allergens compromise defense, causing immune cells to initiate a hyperactive attack protocol, by which we can know about in our body that bacteria, virus, fungi, allergen, pathogens can come and leading to much more chronic or severe acute reactions. So by this we can know that cytokine storm is happen, so that it suggests that we have any kind of infection, so that our body reacts against them. That is Langerhans cells process foreign protein, so that we can that Langerhans cells invades the pathogens and toxins through the body. Second one is the T helper cells trigger signaling cells. There is we all know about the T helper cells, right? So it can release interleukin 4, interleukin 30, and interleukin 17. We all know in COVID time that interleukin we give alpha interleukin alpha ferron. So at that time in COVID also cytokine storm is released. So skin which kind of stuff that interleukin 4, interleukin 13, and interleukin 17 releases, that is signaling that there is a in our body pathogenic cytokine storm is happening. You can see over here the skin one is there, tumor necrosis factor alpha, interleukin 1b, interleukin 6. Then in the second one image is healing wound, type 3 collagen, that is building the skin, interleukin 1, tumor necrosis factor alpha. There is a fibroblast is there. There is a blood vessel. You can see there is a proliferative phase. First one is the inflammatory phase. In inflammation, interleukin 1, 13, and 1, 4, 13, and 17 releases. And in the proliferative phase, we see the type 3 collagen is there. And the third one is the healing phase. Completely skin is the collagen very perfectly, and there is no any kind of skin barrier is there, right? So in whichever body pathogenic cytokine storm is also there, so that we know about the disease properly and we can get another management according to the disease, right? Now we can moving ahead with the cellular pileup, right? We see the pathogenic cytokine storm. Now we go with the cellular pileup, that is accelerated discrimination kinetics. The standard transit window for keratinocyte 28 days drops to a rapid 3-day sprint due to inflammatory cytokines. That is accelerated discrimination kinetics. The standard transit window for keratinocyte, that is 28 days, drops to a rapid 3-day sprint due to inflammatory cytokines. Here, what they are saying is that keratinocytes takes 28 days to drop, but in this cytokine storm, it is hardly 3 days to sprint due to inflammatory cytokine. Right? Second one is hyperkeratosis. That is in which immature nucleated cells take prematurely, leading to psoriatic form, silver scale configuration. Hyperkeratosis is also another kind of skin disease in which immature nucleated cells stack prematurely and leading to psoriatic form. And we all know what is psoriasis. In silvery plaque, a silvery scaled configuration, right? So that is a cellular pileup. Now we are moving ahead with the pathogen takeover. Uh, Pathogen takeover, right? In which microbial dysbiosis dynamics, failure of the skin barrier shifts the environment from acidic towards the alkaline, inviting dermatophytes, fungi. So in which the loss of antimicrobial peptides, fungi releases keratinase enzymes, digestion of the structural surface keratin, and outward spreading the geometric rings. So what here they are saying is that failure of the skin barrier shifts the environment from acidic towards the alkaline and inviting dermatophyte fungi because skin protecting barrier is very degraded and bacteria, viruses, and fungi are also moving ahead inside the body. So loss of the antimicrobial peptides. Second one is the fungi release keratinase enzymes. Third one is the digestion of structural surface keratin and the outward spread in geometric rings. Now we are moving ahead with the vicious loop, in which vicious loop is include neural excitation, physical trauma, and chemical release, right? In neural excitation, cytokine excite unmyelinated epidermal nerve fibers. Cytokine is excited and unmyelinated epidermal nerve fibers, which we can see over the vicious loop. The second one is the physical trauma. Scratching breaks the remaining barrier mechanically. If we have any kind of skin disease or just suppose we have itching and we are mechanically just scratching the skin, then it also breaks the protective layer of the skin, and then bacteria and viruses get chance to ahead more and more and more, giving more trauma to the skin. And the third one is the chemical release. That is, damage releases further signals, cementing the cycles. Also chemical releases, and it can further signals to proceeding ahead and continue the cycle, right? Now, first one is the ringworm. As our topic is beyond the skin, insight, homeopathic integrative insight into the ringworm and eczema. The first one is the ringworm, the fungal portrait. Ringworm is caused by the tinea infection, right? There is a many kind of tinea infection is there. Tinea pedis. That is also seen on the athletic players, athletic foot between the toes, at the fingers, right? Tinea cruris, which is also occurred in the groin region. It is known as the tinea cruris. This one is known as tinea corporis because there is a much round, there is much outside ring-like structure, so that it indicates that the outside ring contains very fungi that is caused by the tinea infections, and it is also known as the tinea corporis. Right, there is another kind of tinea infection is that tinea barbi, which can occur at the barbarella, and tinea capitis, which also occur on the scalp. If tinea infection occur on the scalp, then we can call it as a tinea capitis. So tinea cruris, tinea pedis, tinea capitis, tinea corporis, many kind of infection is there. So tinea corporis is the fungal portrait, a contagious fungal infection caused by dermatophytes colonizing keratinized metric beds. What is the clinical phenotype of that? That is annular erythematous lesions with elevated scaly boundaries and central clearing, right? You can perfectly see over the image is that there is a circular annular image, erythematous lesions outside with elevated scaly boundaries and central clearing. So it is a purely tinea infection, and tinea corporis is there. Now, what is the clinical architecture? Circular red lesion with highly defined borders. Circular red lesions that is very intense and scaling. Ring shape due to peripheral fungal activity, common in humid moisture tapping zone. So in humid and moisturizing area, we also all know about fungal activities, many more in that kind of area, and people get easily affected by the fungus, and that kind of fungal disease take place, and at that time homeopathy come to the rescue, right? transmitter vectors by which it can transmit. So from the humans, from animals, from fomites, or from using someone's clothing and towels as well, by which we can get fungal infection. It might be anything: Tinea cruris, Tinea pedis, Tinea unguium. If occurs on the nails, then we can call it as a Tinea unguium, which takes many a longer time to recover. There is a one case of mine I treated with the homeopathy. You can see the before structure over the neck. It is tinea corporis, right? And in this, I gave a graphitis within a 1.5 month. It completely cures. So here are the perfect example treating patient as a whole and not with just the sign and symptoms. So here I gave graphitis medicine, and as I mentioned, that results may vary from person to person. If that kind of tinea corporis infection over the neck having another person, and you people can give graphitis, then it might not be taking results as I give, because person to person is very different in individualization, compatibility, and immunity also different. So on the basis of case taking proper, on the basis of knowing everything about the disease condition, then and then we can apply the homeopathic medicine and we can get perfect, wonderful result, right? So here are the one case. The before structure is like that on over the neck, and after structure is that treated with the homeopathic medicine, graphitis. Duration is 6 weeks, and results may vary from person to person. What are the predisposing factor? Predisposing factor is that sweating. First of all, if sweating much more having what to say, sweating are also playing major part having fungal diseases, because hyperhidrosis creates the damp soil fungi love. Here are the wonderful line, that's fungi love, that is sweating. So if sweating takes place in the body, then fungi is easily growable, and we can get tinea infection very easily. So first one is the sweating, second one is diabetes, elevated glucose levels after skin chemistry. So that kind of stuff is also important, because sugar patient having hypoglycemia as well, so they can get much more sweating. Here, why diabetes is included? Because if patient having hypoglycemia, then we all know sugar level is elevated or down, then patient is very perspired, right? So at that kind of scenario, patient also getting chances of skin disease condition as well. So sweating, second one is diabetes, and third one is the hygiene. The tight clothing and lack of moisture evaporation is also plays a very important part in the predisposing to having the tinea infection, right? So first one is the sweating, the second one is the diabetes, and third one is the hygiene. So we have to maintain proper hygiene. We give advice to the patient that don't do a tight clothing around the neck region, around the waist region, so that they don't get skin infection easily, and moisturization evaporation occurs. Now, ringworm management, how we can manage ringworm? First of all, the holistic protocol is that enhanced hygiene practices. So as I told earlier, that give patient advice about the hygiene, maintain proper hygiene. Second one is the moisture control and loose clothing, proper moisturize the skin regularly, drink plenty of water. Third one is the immunity enhancement via nutrition. Constitutional homeopathy management must focus on making the skin environment inhospitable to fungal seed. Uh, I I will eventually give idea about the soil versus seed last. Remember me. Enhanced hygiene practices, moisture control, and loose clothing. Right. So how we can give proper advice to the patient that you can do this kind of stuff, and then you can get not easily that kind of skin condition. That is another example of ringworm. Ringworm, that is circulated margin over here, but inside the space is very clear. So it suggests that these are invaded by the fungi, that is Tinea corporis, right? This is also a tinea infection. There is a multiple, that is, we call it as a ringworm vulgaris, right? So there is also ringworm infections. Images you can show over here. What is the top 10 medicine? I just put uh, 10 medicines of homeopathy that can very useful in the managing the ringworm, but there are also lots of medicine in homeopathy which do wonders in day-to-day life. The first one is the tellurium, second one is sepia, third one is the sulfur, fourth one is the basilinum, fifth one is the graphitis, sixth one is the arsenicum album, seventh one is the sorinum, eighth one is the thuja, ninth one is the natrum mu, and the 10th one is calcarea carbonica, right? There is another case of mine that a patient having this kind of fungal infection. uh, I guess after 2 months, uh, patient getting these results. It is wonderful. As I told earlier, that when every pathy fails, then homeopathy comes to the rescue in this kind of skin condition, right? So it is a proud. We have a very proud moment for us that homeopathy can do wonders in day-to-day life where other pathy fails. That is a deep dive into the ringworm. That Tellurium metallicum, 1% having a perfect geometry, intersecting circular rings with unbearable itching, offensive fishy discharge. Right here, what here they are saying is that if person having offensive fishy discharge, that is a key important point of Tellurium metallicum. On the basis of that, you can give Tellurium metallicum and you get the wonderful results. Right in the second one, Sepia officinalis is a flexural target, thrives in dark skin folds, groin, axilla, transitions from itching to burning. I have a patient of mine, I remember that on the sepias, in we medicine, we know about sepia, that patient can't say pia to the loved ones. Patient has indifferent to the loved ones. They have patient and patient having ringworm. But on the basis of looking at ringworm and skin condition, sepia is not indicated. But we treat the person as a whole. Patient having very indifferent to loved ones. He is very, what to say, very burning itching and very indifferent to loved ones. So I just thought that it is a complete picture of the sepia. And I just give sepia medicine and I got wonderful results on them. Then I believe that if we see the person as a whole, not by just looking at the sign and symptom and outside the picture, but if we see the person as a whole, their sign and symptoms, their also mental regarding issues, their compatibility to the environment, if we conclude this and we can get perfect medicine and we can prescribe it to the that particular patient, then we can get wonderful results for sure. So I have give that patient a safety officinalis, and within 1.5 months patient get cured. And the soric root. Many people have soric root, like sulfur is a soric medicine. The anti-soric giant, we can say it is a giant as well. Intense burning, itching, and aggravated by heat and washing. Skin looks dirty. So all that kind of stuff you see on the patient, then give sulfur. Basilinum indicated when there is a tubercular history or when ringworm is persistent recurring. When ringworm is persistently recurring, one after another, if patient having ringworm and after 2 months having that kind of same sign and symptoms and recurring the tinnial infection, then we can give basilinum medicine. It can do the wonders. Now the second one is the eczema. First of all, what is eczema? So that eczema is a chronic inflammatory profile in which a multifactorial non-infectious inflammatory disease categorized by the significant barrier compromised. There is a two types of eczema. There is a dry eczema and the wet eczema. Dry one is a very thickened lichenified patches, and the second one is a wet variant, that is continuous oozing and weeping. So here is the another patient of mine, eczema treated with the homeopathic medicine, that is rux toxicodendron. Duration is about to 8 weeks, and the patient reduced redness and inflammation, relief from itching and irritation, healthier and smoother skin. This patient having first motion aggravation and continuous motion relief. Rostox having specific symptoms. Patient having right. We see the patient having eczema, right? We see over the skin, but we see the person as a whole. So patient firstly narrated, sir, I wake up in the morning and as soon as I step into the ground, then it's very, very, what to say, I can't explain this kind of what they are saying. So, and when the continuous walking, it ameliorates. But here are this symptom is very important, because along with the skin condition, patient having this kind of important topic or important lines which including the rust, and we give rust toxicodendron in the 30C potency, and you won't believe patient completely get cured within the 8 weeks, 2 months. So here are the also wonderful what to say, miracle of homeopathy by seeing the patient as a whole, right? There are, as I told earlier, that many type of eczema, atopic eczema. There is a contact dermatitis in which contact to the chemicals, dyes, etc., which lead to the dermatitis as well. So it is known as a contact dermatitis. Third one is the seborrheic dermatitis, in which seborrheic dermatitis from white to yellowish transformation, right? Having pus formation, so we can call it as a seborrheic dermatitis. Third one is the nummular dermatitis. It looks like a cone type eczema. So we can call is a nummular eczema. It is. What triggers allergens, pollutants, stress and anxiety, whether that is winter cold, and the genetic filigrane lack. As I firstly told, that filigrane is very important protein. If we can lack this protein, then protective barrier is not much more strong and invades very directly from the outside. That is bacteria, virus, fungi, pathogens, and allergens, and we can get lots of skin diseases. But for the God's grace, we have this kind of proteins, and we can't get easily skin condition, right? Here is the another example of the eczema treated with the homeopathy. The before picture is looks like this, and the after one is this. Disease progression, how it progress. Firstly, eczema moves through the phases of inflammation, vesiculation, and chronic thickening. Acute, that is redness, vesicles, and weeping. Subacute in with the scaling and crusting. And the third one is the chronic. It is very thick, leathery, and elephant skin, right? So here how that can proceed in with from the acute to chronic. First one is the acute, subacute, and then chronic. You can see that is a dry eczema in the first slide, and in the second one is the eczema that is wet, right? You can see some kind of moisturizer is there, so that is called is a wet eczema. And there is a in first image not get proper moisturization and nourishment of the skin, and then it is called as dry eczema. Here I also included the top 10 medicine of the eczema according to my knowledge. That is first one is the graphitis, second one is sulfur, third one is the petroleum, fourth one is the mesoryum, fifth one is the rustrox, sorinum, arsenic, calcareum, natrum, and lycopodium, right? Here are some examples of there is a thing about the graphitis and petroleum. If we sunny like fluid discharge, then we can give graphitis, and then winter aggravation patient having, then we can give petroleum.
Yes,
There is
doctor.
other eruptive medicines, mesoryum, rustrox, and arsenic, right? Here saying topical steroid reduce lesions but drive the disease inward. That is a Herring's law of cure. Suppressed infantile eczema transform into severe asthmatic condition. And here homeopathy emphasizes internal healing, allowing the vital force to expect pathology outside. So yeah, homeopathic case taking is there. If we can take proper case taking, which is patient is hot and chilly, craving which kind of foods they crave, which kind of location and order, sleep, which kind of sleep they are having, position and dreams, all that things matters a lot. There is a miasmatic aspect, the psora, psychosis, and syphilis, right? So we can give according to the medicine anti-psoric, anti-psychotic, anti-syphilitic. So there is a miasmatic approach. It is a diagram, the psora, tubercular, syphilis, psychosis. Is psora having this, syphilis having, psychosis having growth excess of benign, if it is syphilitic active, then cancer, and then syphilitic kind of condition. Now it is a psychosomatic relation. If I told earlier about the unexpressed grief, separation of anxiety, and compromised emotional boundaries, ringworm, feeling of being exploited, emotionally unclean, or trapped in circles. So it is also related to the psychosomatic disease. It is a clinical pro tip for the doctors that evaluate sleep energy before the skin changes. Potency prudence, open hyperactive cases with low doses, water doses,
Yes,
6C and 30C, then
yes,
minimal dosing, halt remedy frequency as soon as the cycle downshift, and the final, build confidence that educate on the diet, lifestyle, and immunity.
yes, Dr. Pratik and Nikam, it's really
Yes,
a
yes.
powerful session.
Finally, just wanted to one line. Homeopathy seeks to strengthen the soil rather than merely attacking the seed. And true healing comes from the restoring harmony of mind, body, and vitality. The physician's highest and only calling is to restore the sick to health, as Dr. Hahnemann said, and this can do the wonders in homeopathy. So, thank you so much for listening me very quite fully. Thank you.
Yes, yes, it's really congratulations, a great session, and you really rocked with a powerful session. And homeopathy is the beneficiary from your presentation. That's
Yes,
what
yes.
I because we need such kind of sessions about what is what and how it can proceed and what how a homeopathic doctor need to look into and when and where we can prescribe and how the medicine works and everything were described in a beautiful way. Congratulations, and I think there is no time for discussion, so I am inviting Dr. Ramparesh sir to say a few words and you can conclude the session since there is no time. Actually, we need at least 10 minutes for discussion. This being a big session, you couldn't stop it in time, so there is no problem in that. Yes, Dr. Bob also wants to talk. Okay. Ram Prasad sir, you can talk for the time, and then I shall call Dr. Bob from Malaysia to say a few words and what to thank. Okay, Dr. Ram, please
Thank
unmute.
you, Dr. Dhaneji. Congratulations, Dr. Pratik. Very nice, excellent session. Eczema and ringworm. So, according to role of miasmatic, eczema and ringworm, sora, psychosis, syphilis, and diathesis, tuberculosis diathesis. Underfoot describe the anatomy, physiology, and lot of medicine, 10 medicine, garpitis, syphia, meserium, and tellurium. So very, very thanks, Dr. Pratik. Time is short. Thank you.
Okay, thank you, Dr. Ambrose, sir.
Thank
And
you.
now
Thank
it
you
is
so much
up to
Thank you. Thank you.
up to Dr. Boblin from Malaysia. You can speak.
Thank you very much, Dr. Danesh. This has been a very, very informative and very highly technical webinar today. And I would like to thank Dr. Pratik K. NAKUM for a very successful 2094 day of uninterrupted daily webinar of the IFPH International Forum for Promoting Homeopathy. Once again, we'd like to hear from you and more case taking for the skin problem. And thank you very much for a wonderful session tonight. Over to you, Dr. Danesh.
Yes, Dr. Pratik, do you want to say anything?
Yeah, just wanted to say about that. The topic itself suggests beyond the skin, right? I told 2 or 3 cases regarding sepia and rust toxicity, patient first motion aggravation, continuous motion aggravation. So in Materia Medica, properly written about that. If we look at properly with the focus and properly with knowing sign and symptoms of the bodic Materia Medica, Fatak Materia Medica, then we can directly clicking our mind and at that particular symptoms patient narrates. It is not about that written something else, patient narrates something else. We just have to the bridge. We have to connect some kind of bridge in our mind, joints bridge. Then we can evaluate the medicine's knowledge, right? If why patient narrating that kind of stuff, that patient having fast motion aggravation and continuous motion amelioration, patient feels that. So there is a rust toxicodynamic is the wonderful medicine for that, and patient get cured by this. And that is a
Yes,
skin infection, not any other kind of rheumatic infection is there. So we see the person as a whole, not just sign and symptoms only. And I just remember sepia as can't say pia. That is indifferent to loved ones. And patient exactly that kind of symptom that I don't have any feeling to with my partner and don't love my husband. Right, that kind of symptoms patient narrating, and that is the also written in the Materia Medica. And sepia is the medicine, and that wonderful medicines cure ringworm. You won't believe that this kind of homeopathic do wonders in day-to-day life.
yes, exactly. Thank you, Dr. Pratik Nikam, Dr. Ramprasad Susa, Dr. Bob Lim, and those who attend the English session. Tomorrow we will have a session from Dr. Prakash Rao, and Dr. will be discussing about fever, homeopathy, and its research. Thank you all.
Thank you so much for giving such a chance, and you continue this kind of a platform to evaluate the knowledge of homeopathy and spread the homeopathy throughout the world, right?
Okay, please come up with some more presentation in the future. Thank you all. Good night. Over
Thank
to Dr. Shaila
Thank you.
tomorrow.
Thank you so much.
Session.